The Dr. Taz Show, the podcast. Dr. Taz, Superwoman Wellness. Here's Dr. Taz.
Welcome back, everyone. Welcome back to this episode of Superwoman Wellness, where you know I'm determined to bring you back to your superpowered self. And joining me today is a much needed guest. We're sitting here at this time in the middle of quarantine, COVID-19, and I've brought on Dr. Eric Karchmer. He is a practicing Chinese medical doctor, medical anthropologist, and co-founder and chief doctor of Chinese medicine for DAO Labs. From 1995 to 2000, Eric studied at the Beijing University of Chinese Medicine, and today is both a licensed acupuncturist and professor at Appalachian State University. Welcome to the show, Dr. Karchmer.
Hi, Dr. Taz. Thanks for having me.
Oh, we're thrilled to have you, and we need help. Tell me what you think is happening. I mean, I could ask you a million questions. Many people that listen to the show already know that I'm a big believer in Chinese medicine. I'm a licensed acupuncturist as well. But, you know, what is happening to our planet, I think is my question. And what do you think is happening from a Chinese medicine standpoint? You know, as you and I sit here today, most of the country is in some sort of quarantine or lockdown, you know, different rules, different states, but most of the world, you know, is in lockdown. And we've seen the rapid spread of COVID-19. And I don't think it's the end, because I think the viruses and the bacteria and all of those things are going to continue to change and mutate. So for everybody out there listening who's so fixated on COVID-19, you know, let's talk about that, but let's talk about the bigger problem. So I'll let you take it from there.
Well, I think you're right. I think it could be just the beginning. And I do think Chinese medicine has a really important role to play here for some fresh perspectives and alternatives. And your listeners may or may not be familiar. You know, this is really sort of round two, if you will, with coronavirus, because back in 2003, we had the SARS epidemic, which kind of petered out, but it was a real crisis, and it was not as infectious or contagious as COVID-19 is, but it had a higher mortality rate. And I remember kind of at that time sort of thinking, how did we get so, it was very scary, but we kind of got lucky and all the quarantine measures worked well enough and it sort of disappeared. But now we've got another version of the coronavirus. And I'm just not sure if it's going to go away, but I do think Chinese medicine can be a help here. And in fact, actually, because I do research in China, as you mentioned, I've been in contact with some colleagues in China, and it's really actually Chinese medicine being used very widely right now to address the epidemic in China. And I think it's just and the Chinese government is now sort of starting to really claim some real results from that. And so I think it's a reminder that we don't want to give up on all of our public health measures and all of our tools of but we need some additional ones. And so I think what's happening in China is a good reminder of that.
Yeah, I agree. And why do you think SARS, the first coronavirus in 2003, kind of petered out, whereas this one, at least from my perspective, seems to be more extreme with its global spread and all the other stuff? What do you think is happening there?
Well, I mean, I think, I just think I think this one is more contagious. It's not as virulent. So a lot of people that's also, I think, what makes it tricky is, some people have very mild cases of it. I have a sister-in-law and probably a brother and lots of friends who I think have all been sick with it already, but they never got tested. So it's probably out there to a much greater extent than we even realized. And in 2003, because it just was a little bit more slow moving, and it really was centered in China and got to a few other places. But of course, in China, you've got a one-party state there, and you've got the possibility of some really draconian measures, which they've implemented again. But it wasn't even that in China couldn't really contain this one. So I just think we're in a new world.
Interesting. Sure. Well, from a Chinese medicine perspective, talk to us a little bit about, you know, COVID-19, you know, bacterial and viral invasion of your immune system itself, you know, the things we can do. Because I stand, and you may know this if you listen to some of my episodes, but I stand firmly in that there's only so much we can control the external environment,
Yeah.
but there's a lot that we can do to control our internal environment. So what's the Chinese medicine kind of perspective on all of that?
Yeah, 100%. And so your perspective really is totally in line with a Chinese medicine perspective too. So a couple of basic things about Chinese medicine. One, it's interesting because microorganisms, viruses, bacteria, that's never been a part of Chinese medicine. It emerged long before people had that kind of knowledge. So it's got a different sort of toolkit for thinking about illnesses that that are sort of invade from the outside. And it's also got another kind of perspective that's really important that kind of gets to what you're talking about. Chinese medicine is also very attentive to like who gets sick and who doesn't get sick. So we're seeing very clearly in this epidemic that the elderly, people 70 and above, they're the most vulnerable. There's kind of an interesting way of thinking about that in Chinese medicine, and that's usually through this idea of like a deficiency. As we get on in age, we become vulnerable, and you can think of a deficiency as a vulnerability. And we become vulnerable in different ways. Chinese medicine is really good at thinking about that, and also really good at addressing that. I know in your, I was just listening to one of your other podcasts where you're talking about astragalus.
Yes, my favorite.
A classic example.
Yeah.
Astragalus is actually would be extremely useful in this situation because astragalus supplements qi, and particularly sort of this, we think of this idea of like defensive qi, something that kind of like is on the boundaries of the body, and defends against kind of external invasion, if you will. So Chinese medicine has always been kind of attentive to that, and always been attentive to like the medicinals, the herbs, and things like that help kind of address the body in that way. In Western medicine, we're extremely focused on, the origin of illness. So here it's a microorganism, and so we're looking for antiviral drugs that attack the virus, or we have antibiotics that attack the bacteria. But Chinese medicine has kind of emerged with like different strategies, and when you treat things like this in Chinese medicine, you never treat with sort of one drug. So in Western medicine, we're very focused on sort of that compound that kills the virus or kills the bacteria. In Chinese medicine, the strategy has always been to use a combination of drugs and think about how that combination works together with your body to get it back in balance, so that you can either it's whether it's an acute infection or if it's something chronic, it's sort of trying to like help the body do and get to the place it'd rather be, as opposed to sort of kill a microorganism or interrupt some sort of physiological mechanism.
Do you think, so in China, are they adopting any of sort of these herbal remedies or things like that to help fight COVID-19? And would that not be maybe a better approach than the current approach of like shutting the whole world down and seeing economies crash? And I think we're going to have a mental health crisis next. I think that's what's next. So
I know. So I think that, and in China, it's extremely strict quarantine. So, and the government can do that, but and maybe the economy is strong enough there that they'll get away with it. But they have been, one thing that's been very interesting is the government has really been pushing Chinese medicine treatments clinically. This is also a departure from SARS back in 2003. And there's kind of an interesting history in China where for a long time in the 20th century, let's just say the 20th century, broadly speaking, Chinese medicine was looked as something backwards, a throwback to an earlier society, something that's sort of opposed to or interferes with modernization. And so that was a very strong sentiment, certainly among kind of political elites and things like that.
Right.
And SARS in 2003 was a bit of and that's actually not true. Chinese medicine is quite effective at treating something, lots of acute illnesses, and I would think it would be quite helpful, or the reports out of China are also quite helpful with COVID-19. But that wasn't, like, a lot of people sort of forgot that until SARS in 2003 happened, and then and then Chinese medicine doctors started getting involved in that, and since there was no Western medicine treatments for that, very life-threatening, they kind of were sort of rediscovering some of their skills at treating this sort of thing. And when this epidemic came along, the Chinese government, and there's been a shift of leadership too, which is also important too, it's really been pushing it. And so some reports I heard this is from the state council. These are sort of like upper level federal government or central government authorities were saying that maybe up to 90% of patients in China have been receiving treatment with Chinese herbal medicine. And then they've been doing, now Chinese herbal medicine, for your viewers too, also is not a one size fits all. So just like you said, it's a combination of drugs. It also, treatments will be might be tailored to just how severe the condition is. So a mild case might be treated very differently than something that's really causing a pneumonia. It would absolutely have to be very different. But
so are they bringing in the Chinese herbalist along with the more conventional, so to speak, physicians in a partnership and working together? Yes,
I think you could really say I think in a partnership, and I don't know exactly all the details, but there is this report I read, I think, was said 5,000 doctors of Chinese medicine have been sent to various centers for to be involved in the treatment. Also, China has like two parallel institutions of medical practice. You've got your institutions of Western medicine, or like ours here in the US, and then you've got institutions of Chinese medicine. Chinese medicine was sort of the country cousin for a little while, and it's not as big, but it's still a major institution with universities and hospitals. So I suspect what's happening is patients are kind of going into both types of hospitals, but then even in the Western medicine hospitals, my sense is you're also getting Chinese medicine doctors involved in those treatments.
That's amazing. I think that's good, because I know for a while were just sort of anti. When do you think, is there much of a movement? I've just been super frustrated watching a lot of the coverage. I'm like, well, we just need to put everybody on this, And do you think we'll get to that point in this country where there can be a true collaborative relationship? Like, I think there's some early studies on IV vitamin C from China and remission of COVID-19. And we've tried to reach out to some of the hospitals, and you get the standard answer, right? There are no studies, there's no data, but there's no studies or data on anything, So, I mean, do you think we'll get to that point in this country? Or?
Oh, I do think we will. I still think we have a ways to go, but something like this might really be a catalyst. So I just know, because I'm also a clinical practitioner, so I know, just like ordering supplies for my clinic, all the herbal medicine suppliers are they're totally swamped with orders. As you mentioned, I have my own little company, DAO Labs, and suddenly, our orders are doubling and tripling too, because people are kind of looking for alternatives. So I think we might get there. And I would say that to get back to your kind of question about prevention too, we're hearing about sort of like clinical treatments for people who are sick with COVID-19, but there are like these really powerful formulas that could be, or approaches, and you've kind of talked about things I know in your other podcasts about sort of, strengthening your body. I think this is what you're all about, right? And helping to make yourself as balanced and healthy as possible, so that the chances of you getting infected are minimized, or when you do get an infection, you bounce back much more quickly. It's a much more one. So there's a ton of options. I would say also, I've done a little research on the SARS epidemic in 2003, and I had the privilege of interviewing a very famous doctor who was in his 90s. This is about now 10 years ago, and he sadly passed away recently. But he couldn't stop talking to me about how important the SARS epidemic in 2003 was. He said, because this is when young doctors of Chinese medicine realize what they can do. And he said, and what they can do hasn't, they're only, it's not even in sort of like the reports, which are probably all in Chinese. He says, because, a lot of the doctors here, and this is in Guangzhou, were also, many of them stayed healthy while working through the epidemic and treating patients, because they were all taking Chinese herbs prophylactically, according to him. And so, they were doing some of these formulas that are, cheese supplementing or what have you. And so he said, just if you just looked at the numbers from like SARS in 2003, it doesn't tell the whole story. And I think when we kind of hear the story of COVID-19, at least in China, when we get that story, we're going to get more of that too. And so hopefully this is at least if there's one positive thing that comes out of this, is we'll have a little shift in thinking here.
I think hopefully my hope is that we'll be more open. We'll be more open to alternative modalities, other ways of thinking, understanding that we're a global family, and that what one of us does impacts everybody. And, all of that. Now, I do remember reading on the 3 layers of immunity in Chinese medicine. I've forgotten the names. There's the Wei Qi, and then the central, and then the internal. But one is your external environment, one is your body, and then one is your emotional state. And one of the things I love the most about Chinese medicine is it does such a great job connecting our emotional state to our overall body chemistry and immunity and inflammation and things like that. What would you tell folks right now who might be sitting in a quarantine and having a lot of anxiety about being isolated, or, just uncertainty about what's happening in the world? How would you approach them from a Chinese medicine perspective?
Well, I think your point is so important. So maybe if there's one takeaway lesson from Chinese medicine, is that it is extremely holistic, and there is no separation between mind and body. So we can't just sort of treat our anxieties or our depressions with pills that sort of make the symptoms go away but never get at the root of the problem. So in Chinese medicine, any treatment for emotional issues, psychological issues, always is a treatment of the body. So it's all kind of a whole. So you really want to pay attention to this, and to kind of make a little connection back to women's health. Shadowing doctors and shadowing Chinese medicine gynecologists in China. One of the things that always it made me kind of chuckle, but it was really profound, was they would always kind of look at their, this would happen multiple times in a morning. They'd look across the table at the patient they're consulting with, and they're like, and you need to control your anger.
Oh, wow.
You need to work on your anger. It just doesn't quite translate in English, because you think of anger as this thing that's beyond control, right?
Right.
But they really were and now, of course, as they were saying that, they're doing things in their formulas that are going to, soothe the liver, or other things are going to, help to achieve some of that emotional balance that goes with it. But at the same time, they're saying, hey, you need to kind of work on this too. Mm-hmm. So I think it's just kind of a reminder, in a moment like this, we can't let the stress get the better of us. We need to work on that. We need to kind of work on everything, but you also can't think that your chronic stomach issues are unrelated either. Those need to be addressed. So my most general advice for anyone out there is that, work on whatever the best way you can be prepared for COVID-19 is to start working on all the problems that you're sort of dealing with. So if you've got, an autoimmune condition, you got to focus on that, stomach issues, what have you. So I think that's all essential. And I think the emotions are just a really key part of it. And I think that part of Chinese medicine is really profound. We often theorize that the emotions as being connected to the organs. Mm-hmm. So sadness in the lungs, pensiveness in the spleen, anger in the liver. Yeah, that's fear in the kidneys. And you don't necessarily always kind of treat it quite that. That might sound a little bit rigid. You don't necessarily always treat it along those lines, but it is a reminder that emotions aren't in the brain. They aren't somewhere separated from your body. They're just most fundamentally in the body.
Yeah. And I think that's such an important point, because, even in working with patients and flipping out of Chinese medicine and maybe into some of the other things that I do, when there's chronic inflammation, when there's chronic gut issues, when there are nutritional deficiencies, when there's chronic stress, when there's trauma, you're in a low qi state, right? You don't have the reserves or the energy to fight anything off, leave alone a virus like COVID-19. So I think it's really a call for all of us to optimize our health and to understand the connection between the way we live, who we live with, what our emotional state is, what our physical state is, and really own it, and not just get by with sort of that stamp of you're fine, right? Because I think that's what the majority of people hear. Whereas in Chinese medicine, the beauty is you never get that you're fine. You get here are the 5 things you can continue to work on to be up here, Right. So I think that to me is one of the fundamental difference. If someone wants to learn more about Chinese medicine and how it may apply to their lives, what's your favorite resource?
Well, can I plug my little company?
Of course, yeah, of course you can.
I do think it is. We're trying to make it a resource. So I would say I'll mention a little bit more scholarly book, but so DAO Labs is my company, and their website is mydaolabs.com. But we do have a blog there, and certainly I would encourage everyone to kind of go there and kind of look, at least, and a lot of people do contribute to it, but certainly I would encourage you all to look for all the things that I've written. I really try to kind of take, I'm sometimes stuck in academia in like a very esoteric world of scholarship, but I do try, like the website for me is an opportunity to really think about how can communicate about Chinese medicine in a language that like everyday readers
they can relate to,
can understand. And so I do try to do that. I wrote a little link about just COVID-19 just recently on the blog.
Okay.
So people kind of go there and read about like, how can, in fact, my wife even asked me this. She's like, she was like, wait a second, you're telling me that you think Chinese medicine, like you yourself, can treat COVID-19 when there's like no drug drug out there that treats it? It's like, yes, I do. Well,
I've been pretty desperate, quite honestly. I've been actually.
Everything I've heard about the symptoms, I'm like, well, I've treated hundreds of colds just like that. I feel pretty confident.
Right. Yeah. I'm the same. I've probably taken it a step too far. I've actually reached out to the State Department and to our governor's office. I'm sure no one's going to listen to me, but I see solutions, and I just don't think that we're acting on them,
Yeah, I really agree. And of course, and this is not to minimize like really severe cases and critical cases.
Not at all.
And those are so concerning, but and that's probably going to be happening too. But if we can prevent some people from ever getting there, and I kind of even wonder too, what will the end story be? It seems to me like we're looking at mortality rates like in Italy, or perhaps what we'll end up with here. I think it's going to be much higher than what they had in China.
I know. We'll see. Well, I think we're almost out of time. So if people want to get a hold of you, the My DAO Labs is the best site. Is that the place?
MyDAOLabs.com is probably the best site. And then there is ways to kind of connect me through there. And please go there and read about it. And we do have, I would mention a couple of products I think that people might want to read about if they're really interested in sort of thinking about like preventative care. So I would encourage them to take a look there. That's probably the best way to reach me.
Perfect. Well, thank you so much for taking time out today to talk to us about Chinese medicine and COVID-19 and what it all really means. For all of you watching today, thank you for watching this episode of Superwoman Wellness. And if you enjoyed this episode, please remember to rate and review it and share it with your friends. We're on Spotify as well. And I will see you guys next time. Please be safe wherever you are. We know many of you are in lockdown or quarantines, but we're a community, we're a team, and we will get through this. See you soon.